So now you provide fit for duty training now for contractors and health and safety professionals. What made you want to do that?
As soon as I sobered up, I realized there was a reason why I had went through what I went through. And the only way that I could, all of the negative things that happened to me, the arrest, the, getting sick, getting in fights, having my nose broken, all of the crazy stuff that goes with addiction, I realized very shortly after I sobered up that the one way that I could actually make that work was to use it to help other people. And my experience with 16 years of daily drug abuse combined with my college training is what allows me to do that. But I wanted to do that. My whole life, I wanted to kind of do a job where I helped people, but I never knew what that would look like. So as soon as I got into recovery, as soon as I sobered up, I realized why I had gone through that 16 years of insanity, if you want to call it that. And it was to help people because I have a unique perspective because I'm dealing with it coming from a person who's been there. I understand how addicts and alcoholics think, not just what they behave like, but I understand the way their minds work as well, which I incorporate into the training that I do. And it's mainly because I enjoy helping people and I'm a people person. I like to help people. In 2002, I enrolled in George Brown College's Human Services Counseling program. In 2004, I graduated as a Human Services Counselor with a major in addictions and a minor in mental health. I started my own business in 2009 to train companies to identify, prepare, and intervene with employees who have an addiction. My training program was painstakingly designed to include all my experience with drug and alcohol addiction. It is comprehensive company training with modules for managers, supervisors, and employees. It was designed from the outset as a training the trainer program so companies have in-house training capability directly supported by me.
So I don't think it's any secret that there is a stigma around addiction, substance abuse in the construction industry specifically.
Yep.
What has been your experience with that?
So my experience of late has been, well, not just of late, but over the years when I've done my training for different constructors, one of the things that I do notice, there's a there's a tough guy, if you want to put it quote unquote tough guy mentality among a lot of the trades and among a lot of the people who work in the industry that shotcrete guys drink more than welders that can drink more than uh, another trade. And it's not, even when I was a welder, like they talked about that, like you grow to have a pride in your trade or your profession. And then you say, well, I can drink more than them, or I can take more drugs than them. And I find that a lot of that tough guy image kind of fuels the the atmosphere of complacency, if you want to use that terminology. And and I think that the stigma is to say that you have a problem in that environment, in that tough guy environment, to say I have a problem. It'd be extremely difficult for someone to come forward if he's been a brother in arms for many years as a drinker or drug user, to come forward and say he has a problem. He'd be concerned that his colleagues would look down upon him in some way, like he's weak or that he can't handle it. And I think that stigma applies to the industry, absolutely. And I also think it applies in a broader sense to everybody who has a problem. But within the construction industry, I think that there's pride taken in the trade that you belong to. And I think that people can use that as an excuse or as a justification to overindulge in things.
So now, when you're doing some of this training, what are some of the tools that you provide to companies to help them deal with substance abuse and addiction in their workplace?
One of the main things that I do is I talk about the psychological I talk about psychological behaviors that people who have an addiction what the proper term is, a moderate to severe substance use disorder, display. So subtle psychological signs are often passed, but what it does is it gives the supervisor a little bit of an idea that this might be a guy that he might want to just take a little bit of a closer look at because of that. And then if his attendance, performance, or behavior is an issue, then he might have reason to do some kind of an intervention with them. That's one of the things, certainly one of the things that I do. Another thing that I do is I teach defensible documentation in my training. So I actually train the supervisors how to write down their observations in a way that would be defensible in court, which for any supervisor on a construction site, especially in 2021, it's essential to be able to properly and solidly document your observations. Number one, to protect yourself. Number two, to protect the company, and to have that written record to refer to in any future intervention that you did. There's another thing that I do actually. I have a friend who's an addict, who's actively an addict, and he's been using marijuana for about 40 years. And I actually talk about the specific effects of the different products at the Ontario Cannabis Store. I talk about the detectability of them, what they look like. I show them pictures. I also show them pictures of illicit substances and the paraphernalia with that, because if they're on the job site, they need to be able to understand what they're seeing. If they see, a glass pipe, for instance, they need to understand that means that there's someone using something that's illegal on the job site. So that's another aspect of my training that I offer, how I help employers identify problems.
Thanks so much, Julian. Is there anything else you'd like to add, or anything that I missed?
I just wanted to say that, with what's going on right now, with what they're calling the other pandemic about the opioid deaths in the industry, I wanted to offer a suggestion to employers. Every Shoppers Drug Mart has kits of what's called Narcan. It's an opioid antagonist. So what it is it's a drug that stops if you have a heroin overdose or a fentanyl overdose, it's binding to the opioid receptors in your brain, and it depresses your breathing, and that's what kills people when they overdose. What this drug does is it blocks those receptors immediately. So even if the person has an overdose of fentanyl in their system, if you gave them the Narcan, the injection, it would actually prevent it from being fatal. And these kits are available freely at Shoppers Drug Mart. I don't know if they're designated, but certainly the one closest to me. And all it requires is you register for a little bit of training. I think it's 30 or 40 minutes. So I'd encourage all employers to get some designated supervisors out to those drugstores to do that training, to get those kits on site, because those kits can definitely save a life, especially when we're talking about the other pandemic, about the fentanyl laced OxyContin and all of that stuff that is such a prevalent problem right now in the industry.
Well, thank you so much for that. I really appreciate your time. Thank you for sharing your story. It's inspiring, and thank you for sharing your tips with our readers. I think they'll really help people on construction sites and even beyond. So thanks for
My
your time.
pleasure.